Should you claim at 65? Should you wait until 67? What about holding out all the way to 70? And what does any of this have to do with Medicare, which kicks in at a completely different age? If you're approaching retirement and feeling overwhelmed by these questions, you are absolutely not alone. Millions of Americans every single year sit down and try to make this decision, and most of them make it without having all the information they need. Today, I'm going to walk you through everything: when to claim, what happens if you're still working, how Medicare fits into all of this, and what your real options are if you change your mind after you've already started collecting. My name is Ed, and I ran the third busiest Social Security office in the country. I've personally processed hundreds of thousands of retirement claims, disability claims, survivor claims, Medicare and Medicaid applications. And before all of that, I served as a sergeant in the United States Marine Corps. So let's get into it. Let's start with the basics of regular retirement benefits. When people talk about Social Security retirement, they're usually talking about your own retirement benefit, a spouse benefit, or a divorced spouse benefit. The earliest you can file for any of those is age 62, not a day before. Now, disability and survivor benefits work on different timelines, and we're not going to get into those today. Today, we're laser-focused on retirement benefits and the age question that keeps so many people up at night. The core rule you need to understand is simple. If you start your benefits before your full retirement age, your monthly check will be permanently reduced. This isn't a new rule. This goes all the way back to 1935, when Franklin Roosevelt signed Social Security into law. The original intent was that Social Security would replace lost wages. If you're still working and still earning, you haven't lost those wages yet. And that's the philosophical foundation behind why filing early comes with a penalty. Now, is that reduction truly permanent? The answer is yes and no. And this is where a lot of financial content online gets it wrong. If you file at 62, 63, 64, anywhere before your full retirement age, and you simply continue receiving those benefits without doing anything else, yes, your benefit is reduced for life. You'll still get the annual cost of living adjustment that every Social Security recipient gets, but the base amount is lower forever. However, there are exceptions, and those exceptions matter enormously depending on your situation. One of those exceptions involves continuing to work. Here's something most people don't realize. Even if you're already collecting Social Security, if you're still working and still paying into the system, Social Security recalculates your benefit every year. The way your benefit is calculated is based on your highest 35 years of earnings. If you have a strong recent year of income, the IRS reports it to Social Security. And if that year is better than one of your previous 35 highest years, they knock out the low year and plug in the new high year, which increases your monthly benefit. This can actually happen twice a year, once based on the updated earnings calculation and once based on the annual cost of living adjustment. So work is not necessarily the enemy of your benefit, even when you're already collecting. Now let's talk about the full retirement age, because this is where so many people get confused. For decades, the full retirement age was 65. It was that way from 1935 all the way until changes made in the early 1980s started phasing it upward. Today, if you were born in 1960 or later, your full retirement age is 67. That's it, 67. The transition happened gradually over the years, and if you were born in 1957, your full retirement age was 66 and 6 months. But going forward, for most people watching this in 2026, you're looking at 67 as your benchmark. Now, there is ongoing political conversation about raising the retirement age again, but as of right now, the current administration has stated they will not raise it and will not cut benefits. And most people would agree that's the right position. The bigger challenge, of course, is figuring out how to keep Social Security solvent without making cuts or raising the age. And I've covered that in depth in many other videos. Here's something that trips people up constantly: the annual earnings test. If you file for Social Security before your full retirement age and you're still working, there is a strict limit on how much you can earn in wages. For 2025, that number was $23,400. Anything above that, Social Security withholds $1 for every $2 you earn over the limit. So if you earn $10,000 over the threshold, you're going to have $5,000 in benefits withheld until you reach your full retirement age. It's important to understand that this limit applies only to wages and self-employment income, not investments, not 401k withdrawals, not rental income, not inheritance. Just W-2 wages or net self-employment earnings. Now, the first year you start your benefits is a little different. In that first year only, you can use a monthly earnings test instead of the annual one. So let's say you start your benefits in July. It doesn't matter that you made a significant income from January through June. What matters is whether you stay under the monthly limit starting in July. For 2025, that monthly limit was $1,950, which is just $23,400 divided by 12. As long as you stay under that monthly ceiling for the rest of the year, you keep receiving your checks. One important warning here. Social Security employees sometimes code this incorrectly in the system. If it's not coded properly, what happens is the following year when the IRS reports your annual income, Social Security sees the full year amount and thinks you owe money back. It's a fixable problem. You simply go to the office and explain that the high income happened before you started benefits and you stayed under the monthly limit after. But it's a headache you want to avoid. And also, you can only use the monthly earnings test one time. After that first year, you are subject to the annual limit going forward. So what happens if you start collecting and then change your mind? Maybe you retired, filed for benefits, and then 2 weeks later realized retirement isn't for you. It happens more than you'd think. There are a couple of ways to handle this. The first is called a withdrawal. If you're within 12 months of when your benefits began, you can withdraw your application entirely. It's as if you never filed. The catch is that you have to repay every dollar you received during that time. Every check, every Medicare premium that was withheld, all of it goes back. Once the repayment is confirmed and the check clears, your application is treated as if it never existed, and your future benefit is completely unaffected. The second option is called suspending your benefits. This is different from withdrawing. With a suspension, you contact Social Security and tell them you want to stop receiving checks. You don't have to pay anything back. What this does is allow you to accumulate what are called delayed retirement credits going forward, which we'll get to in a moment. When you eventually reinstate your benefits, the system looks at how many months you actually received payments versus how many months your benefit was reduced. If you were supposed to be reduced for 30 months, but you suspended after 10 months and didn't receive the other 20 checks, then at full retirement age, your benefit only reflects the 10 months of actual early filing, not the full 30. This automatic correction is called the Adjusted Reduction Factor, or ARF, and it happens automatically. You don't need to ask for it or file any paperwork. Speaking of Medicare, let's clear this up, because age 65 still matters, even though it's no longer the full retirement age for Social Security. Medicare eligibility begins at 65, full stop. If you do not have what's called creditable coverage at that point, you need to sign up for Medicare or face permanent penalties. What is creditable coverage? It means you or your spouse are currently actively employed, at a company with 20 or more employees, and your health insurance comes through that active employment. COBRA does not count. The Affordable Care Act marketplace does not count. A retiree health plan does not count. It has to be current employment-based coverage. If you don't have that, you sign up for Medicare at 65. If you miss your window, Social Security penalizes you 10% for every 12 months you went without coverage, and that penalty is permanent. Same goes for Part D, the prescription drug plan. Right now, about 11,000 Americans turn 65 every single day. The system is massive, and the decisions are consequential. Part A, which covers hospital stays, is free for most people. Part B, which covers doctor visits and outpatient care, costs $185 per month in 2025. But here's the issue. Part B only covers 80% of your costs, which means you're on the hook for 20%. On a $100,000 medical bill, that's $20,000 out of pocket. That's why most people look at either a Medicare supplement plan, I recommend you evaluate Plan G or Plan N first, or a Medicare Advantage plan. If you go the supplement route, you'll also need a standalone Part D drug plan. If you need help navigating all of this, my partners at Chapter of Medicare are excellent. They look at every plan available in your area. The service is completely free, and tell them I sent you. Now let's get to the big one, delayed retirement credits. If you wait past your full retirement age to collect, your benefit grows by 8% for every year you delay. So if your full retirement age is 67 and you wait until 68, your benefit goes up by 8%. Wait until 70, and you've added 24% on top of your full retirement age benefit. If your baseline benefit at 67 would have been $1,000 a month, waiting until 70 gets you $1,240 a month for the rest of your life. Nobody, and I want to be clear about this, nobody should wait past age 70. The credits stop accumulating at 70. Waiting beyond that means you're literally leaving money on the table. Here's something even most Social Security employees don't know. You can voluntarily request delayed retirement credits even after you've already started collecting. If you haven't yet hit full retirement age, you can call Social Security and ask them to suspend your benefits so you can start accruing those credits. When you're ready to restart, you'll get credit for every month you didn't receive a check. Fair warning, this is an obscure enough provision that the employee on the phone may not know what you're talking about. Don't back down. Ask them to look it up in the POMS, that's the Program Operations Manual System, the Internal Social Security Policy Guide, under Voluntary Delayed Retirement Credits. It's in there. So when should you actually claim? At 65? At 67? At 70? The honest answer is that it depends on your individual situation, and anyone who gives you a one-size-fits-all answer is oversimplifying. The most important question is whether you need the money right now. If you do, claim early and don't let anyone make you feel bad about it. Getting a smaller check today is better than getting no check today. Beyond that, think about whether you have a spouse or dependents who would also benefit from your record. A spouse waiting to claim on your earnings record, or children under 18 or with qualifying disabilities. Starting early can unlock benefits for them immediately, which can more than offset your personal reduction. Think about your health and family history. If longevity runs in your family and you're in good shape today, waiting often makes mathematical sense. Think about taxes. About 40% of Social Security recipients don't pay any federal taxes on their benefits at all. But if your other income pushes you into a higher bracket, early claiming could cost you more in taxes than you'd expect. And finally, think about the political environment. I'm not here to be partisan, but the trust fund situation is real, and it has been real for decades. We've been kicking this can down the road for too long. If nothing changes, automatic benefit cuts could be on the horizon within the next decade. Some people use that uncertainty as a reason to claim earlier rather than count on full benefits later. I think the right response is to also contact your representatives and demand action. Smash the FICA cap, improve Social Security's funding, and protect the benefits the people have spent their entire working lives paying into. The bottom line is this: 65 or 70 is not a simple equation. It's a decision built on your health, your finances, your family, your taxes, and yes, even the political moment we're in. Get the information, think it through, and make the decision that's right for your life. I'll be here to help you do exactly that.